So welcome everyone. I am so excited to be here with you sharing a little bit about this program that came out of the New York City Mayor's Office of the Chief Technology Officer. And this is a program last year to help connect older adults living in NYCHA housing with internet services. First of all, who am I? My name is Elise Vogelai. My pronouns are she and her. I am a user experience designer and researcher, and I work in the New York City Mayor's Office of the Chief Technology Officer. Feel free to check us out on Twitter or at our website. So we are a mayoral agency in New York City. We are a relatively small office. We're about 30 people, and our work spans a number of different disciplines. We have sort of four broad pillars in our office. My work as a designer in the design lab spans all four of these pillars, but the one that we are mostly focusing on today, although this project was certainly a collaboration across their office, is around universal broadband and digital services. First pillar of work is universal broadband. That's about bringing high quality, affordable, safe internet services to all New Yorkers. Our next pillar is digital services. That's around making user-centered and user-friendly digital services so that government really works for folks. Then we also have an inclusive innovation pillar, which is all about bringing new and exciting innovation opportunities to New York City in a way that is inclusive. And then finally, we have our emerging tech and society, which is all about advancing policy for good technology and positive tech use in New York City. So that's a little bit about our office. Like I said, everyone in our office was involved in this project. I'll get a little bit more into all of the different components and people who are involved. I will jump right into a little bit of background before I start talking about the program. This is a little bit of background on the state of internet connectivity in New York City. The stats I'm about to present to you come from the Internet Master Plan, which is a plan that was released by our office by New York City government last January. This is broadband access in New York City. 40% of New Yorkers lack mobile or home broadband, and you can drill down a little bit into that and see that 46% of New Yorkers living in poverty lack access to home broadband. This is obviously a hugely important issue. I think that the pandemic has in particular brought this issue to light. This is certainly something that our office has been working to provide more universal broadband for a long time. I don't know if anyone here is someone who needs to be convinced of the importance of universal broadband, but certainly the pandemic has really brought that to light. From schools to medical care, we all need internet access to be able to live in the modern age. And older adults are especially impacted by the pandemic given their increased risk. Few more stats on this, which is that 18% of New Yorkers lack both mobile and home broadband. This is a really staggering number to think about. In a city of over 8 million people, that's 1.5 million people who lack mobile and home broadband. These statistics are from the Internet Master Plan, which I said came out last January. So obviously huge implications always, but especially huge implications in the era of COVID-19. Think that anyone will find this very shocking, but if you look at a map of home broadband access, it maps really strongly to other inequities in New York City. That's folks living in poverty or lower income. Also, our Black and Brown communities are especially impacted by this. So here's a map of home broadband adoption. You can see the lighter colored areas are low adoption and the darker colored areas are high adoption. And then here is a map of median household income. This came from the American Community Survey, as did the previous map. And you can see it just maps really clearly that broadband access and income are really clearly linked. I don't think anyone here would necessarily disagree with this, but it is really true that internet access is a need and a right, and that is especially so today. It's something our office has been working on for a long time, which is bringing the vision of affordable, high-speed, universal broadband to New York City to life. This program is one small piece in how we've been working on that. So I will go ahead and dive on into what exactly this program was. First of all, this program was a hugely collaborative effort. Different organizations were involved, New York City Department for the Aging, our own office, as well as LG, T-Mobile, Older Adults Technology Services, NYCHA. A ton of people were involved in bringing this project to. So what was it exactly? This was a program last April and May in which we delivered 10,000 internet connected tablets to vulnerable low-income older adults. So these were all older adults living in NYCHA housing in New York City. NYCHA stands for New York City Housing Authority, and that is public housing in New York City. And just as the pandemic was starting last year, we delivered 10,000 tablets, which were pre-connected to the internet. As a quick overview of the program, we in the end ended up delivering 10,000 tablets to 288 NYCHA developments, 37 council districts, and we really focused on areas where the internet adoption was much lower than the city's average. 60% was the average internet adoption rate in the neighborhoods that we ended up targeting, and that's 10 to 20% below the city's average. So we were really focusing on folks who are living in affordable housing, who don't necessarily have great access to internet, and who are really at risk in the pandemic. The program itself had many different components. So we delivered from the tablet coming out of the warehouse at T-Mobile all the way to getting delivered to an individual. There was a whole lot of effort that went into making sure that this was really a holistic and well-designed experience for folks. So we actually worked with people in the T-Mobile warehouses to pre-kit these tablets so that they were all prepped and ready to go as soon as they got into the hands of a participant. So this meant that we went through all of the setup. If you ever set up a new device, there's so many annoying steps that you have to go through. So we went through that whole setup for folks. We installed the SIM already so that it would be ready and waiting to go on the internet. We changed the default background and we installed some key apps on the tablets, including a link to Senior Planet, which has resources specifically for older adults, a link to My NYCHA, link to Gmail, link to other that folks would be using. And then we also included a printed handout in all of these boxes. That was the first thing a person would see when they opened up the box that told them how to start up the tablet and gave them the number to a hotline that they could call for any tech help. So we really did our best to think holistically about this experience and make sure that unboxing the tablet was as easy as possible for folks. We also created an onboarding app. This was a web APK app that would folks learn how to use their new tablet. And we really focused this app on readability, including reading age and ease of use. So we made sure high contrast, large font size, so that it would be easy for folks to read. And then just some general tips on how to get started if you've never used a tablet before, how to access tech support. There was a hotline run by T-Mobile and also a hotline run by the Older Adults Technology Service just to help folks use their device. And then a whole list of resources for people to access, from medicine to groceries to meals to libraries, all sorts of resources just to get folks started with using their tablet. The onboarding app that we created was available in 13 languages, which is really wonderful. We worked with the Mayor's Office of Immigrant Affairs to make sure that the app was translated so that it was really accessible to anyone who might be using the tablet. And we made a lot of design considerations in this, including right to left languages that have more words than English. So for example, a sentence in English is usually 20% longer in Spanish. So that has big considerations for design. And so we really thought long and hard about making sure that this experience was as accessible as possible for everyone who might be using the tablet. We also had this hotline that I mentioned from the Older Adults Technology Service. They did outreach calls to all of the participants in the program to just check in, make sure they got their tablet, see how it was going, see if they needed any help getting set up. And this was also a hotline that was available for folks to call in if they had any issues. Older Adults Technology Services also runs the website Senior, which is a resource website that has all kinds of different events, resources, services specifically for older adults. And so that came pre-installed on the tablets as well. So that's a sort of big overview of the project. And then I'm excited to actually demo to use some of the digital products that we created to support the rollout of this program. The first thing is how we actually identified participants for the program. Actually, NYCHA helped us in making robocalls, and these robocalls were used to identify folks with a tablet. So a call went out, people answered it, they would say yes or no and opt into the program. But in order to first identify which NYCHA developments those robocalls would go to, we had a whole mapping exercise. First, we took a look at broadband adoption data, identified areas of the city with the lowest quartile of home broadband access, and that comes from the broadband adoption basic indicators on NYC. Then we also mapped onto that NYCHA development locations from NYC Open Data. And then we had a couple pieces of data that we were able to get from the agencies we partnered with. One of those things was number of adults over 65 per development. That was data that came from NYCHA. And then finally, we mapped onto that COVID-19 per capita rates in neighborhoods. And this is from a snapshot in time in April. And that data came to us from the Department of Health and Mental Hygiene. So I'm going to go ahead and show you this visualization, which we use to help identify participants for this program. It's basically a visualization of vulnerable older adults, particularly in need of internet-connected devices. So this is the first digital product that we created. It's just a visualization, as I said. This is a visualization. You can see COVID-19 rates are mapped in the brown-orange colors. The blue here indicates lowest quartile of broadband access. And then the bubbles are number of seniors in NYCHA developments. You can see that there are a few areas where there are concentrated numbers of older adults in NYCHA housing in low quartile broadband areas and areas where that were particularly hardest hit by COVID. Like I said, these are the people that we in particular wanted to focus on making sure that they got internet access. You can go ahead and zoom in here. You can zoom in and see, so here is one of the areas that has very hard hit, low broadband access, and high numbers of older adults. You can actually hover on each of these NYCHA developments and see total number of residents and percentage of seniors in those developments. So this is the first internal tool that we created. Super interesting, super helpful for us in terms of deciding where to ship these 10,000 tablets, who to target, because they're the people who need it most. And that was in the end the purpose of this visualization, making sure that we are distributing resources in a way that they're getting to the people who really needed them at this moment in time. This is a snapshot from April. The data is not necessarily up to date, but it was when we used it. So the next digital product that we created was actually a delivery and outreach tracking dashboard. So again, internal to our office, this was for us to track all of the mini metrics. There were so many different things involved in this program. So this was a dashboard for us to track how we were doing, how our progress was going, making sure that we were really staying on target to deliver all 10,000 of these tablets. I'll go ahead and show this as well. Just as a side note, I think it's really exciting to be sharing these with you because, like I mentioned, these were internal tools that we created just for our office to be able to support the rollout of this program. So I think it's a really interesting and cool use of open data that's not necessarily public facing, but it was totally instrumental in getting people connected to the internet in this particular time. There are also plenty of interesting design and data decisions to make when you're creating a tool for a small internal audience. I'm happy to talk about that if anyone's interested. Here we have our tracking dashboard. This is just over time, delivery of tab over the month of May. You can see all of the different pieces of information from this. Then we have an overview, like a progress bar here. How close are we to hitting our target? This is from a snapshot in time, so it is just before the program finished. But you can see how many were delivered, how many were shipped, how close we are to meeting our target at this moment in time. Then we also had a small dashboard here on user acquisition. So this was around the number of robocalls we made. As I mentioned, robocalls were how we first reached out to people to see if they were interested in a tablet. So a ton of robocalls were made. And then this is how many details we received from those robocalls. The call data, by the way, of course, the numbers came from NYCHA. This is how using robocalls is often how they get in touch with residents. And so this was a pretty normal way to be contacted. So then we have information around device prepping and shipping. So I talked about the kitting process. This was happening in the T-Mobile warehouses where they were setting up the tablets so that they would be ready to go as soon as they got to participants. So that was obviously very time consuming. And so we were tracking how many devices were kitted, how many were ready to be shipped, how many had been shipped, and how many had been delivered. And then we're also tracking data from OATS on, this is the Older Adults Technology Service, the hotline and the outgoing calls that I mentioned. So here's how many incoming calls we were getting, how many outgoing calls. Like I said, this is a snapshot in time. To date, there have been over 50,000 calls from OATS, which is really amazing. People are really taking advantage of that technology hotline. And so the folks at OATS are really there to help make sure that older adults can use the tablets really to the maximum effect. And then finally, here is some data on shipping. We got this data from UPS. So all of this different data is coming from different partners. I should have mentioned that. Device prep and shipping was coming from T-Mobile. User acquisition and robocalls coming from NYCHA. that was coming from Oats. And then the cohort analysis here is coming from UPS, who's actually shipping the tablets and delivering them. So really a ton of different pieces of data coming together for this particular tracking dashboard. And then you'll recognize this. It's basically the same map that I just showed, except now it is showing where devices have actually been delivered. You can see how they concentrated on those areas that I pointed out previously with folks who are in hardest hit areas with lowest access to internet already. You can also zoom in on this map. Cannot actually, you can here to see details on exactly how many devices were sent to these locations. And then the map is not always the easiest way to see that. We also have just a list here of all of the NYCHA locations and how many were delivered to them. This list grew bigger and bigger over time. There were 288 NYCHA developments who we delivered to, so I won't scroll all the way through that list. That's an overview of our tracking dashboard. Again, data from lots of different pieces. Some data on that map was from open data, so super helpful for us and really instrumental in the rollout of this program and making sure that folks got connected at such an important time. So I'll just take a minute or two to share some of the stories that we heard from participants because, as I mentioned, I'm a UX researcher and designer, and so obviously we did user research as we were doing this program. So we called folks who were tablet recipients to make sure that the program was really meeting their needs. And we heard some really wonderful stories. And when we were rolling out this program, we were really focused on the key critical ways that people might be using the tablets in a moment that was really scary for a lot of us. So we're really focused on these like critical parts of internet connection, like getting access to food, doctors, medicine, as well as using Zoom to connect with family and friends. And obviously people were using their tablets for all of these purposes, which is really wonderful. So they were definitely getting those critical services that they needed, but they were also using their tablets in really delightful and unexpected ways. So this is a screen cap of a band called the Mighty Clouds of Joy. And by the way, of course, all of our participants consented to having these stories shared. But this was one participant told us about how they had started rediscovering the music of their, I apologize, the sounds of New York are outside me just now. I will give that a second to go past. Yeah, so this participant shared with us how they were using their tablet to reconnect with the music of their youth. So they had rediscovered this band that they used to love on YouTube, and they had just been blasting this music in their apartment and listening to it. I think it's such a wonderful image and such a great way that someone was using the tablet to just keep themselves positive in a really dark time. And then another participant told us about how they were playing this game Roblox. So this is a shot from the game Roblox. I've never played it myself, but it is very popular with the youth. And this participant was telling us how they had been playing this game with their grandson, with their tablet. And these were just such wonderful and human stories about the ways that people were using their newfound internet access to stay connected, to keep their mental health up, and to stay positive in what has obviously been one of the most challenging times any of us has lived through. And finally, this is a fantastic quote that someone gave us, and I'm just going to end on this note, which is that they said to us, "When I got the tablet, I didn't realize how lonesome I was without visits from my children. It's like a connection to the outside without the fear of catching the virus. The tablet brings you closer to people without physical contact." This was just such a rewarding thing to hear, that all of this work really did bring joy and connection to this particular person's life. And with that, I will go ahead and open it up to questions. Here's my contact information. If anyone send me an email afterwards, follow me on Twitter or connect with me on LinkedIn. I'm always happy to chat more, but I'm gonna go ahead and stop sharing my screen so that I can take a look at the questions. So looks like some of the questions have already been answered. So does anyone have any questions that they want to put in the chat now or raise their hands now to ask me? And please go ahead.
Hello, hi, my name is Daphne Brown. I'm actually a project manager in East Harlem at a program which is we're currently trying to do a pilot sending tablets in the East Harlem community. And we're looking for ways to boost engagement, try to sell the point with technology in East Harlem and low income areas. There's a issue of access, but then there's also an issue of just tech savviness and trying to teach technological skills via Zoom or over the phone is very complicated. So do you have any suggestions or strategy to address that? Anything that Oats is using on the technology line? How do you navigate those things?
Yeah, that is such a fantastic question. So thank you for asking. And that sounds like really amazing and important work that you're doing. So awesome. It's really great to hear that other people are focusing on the importance of internet access for folks. It's definitely a challenging question, especially when you're thinking about teaching people how to use technology virtually. And so one of the things that we often talk about when we're thinking about technology is there's a few different layers to it. So one is just access, right? Do you have the technology? Can you get on the internet? Another piece of it is tech literacy. Do you understand how to use the devices, the internet? But then there's this third piece, which is a little bit more nebulous, which is confidence. Are you confident in using this device and in navigating the internet? I think sometimes those last two get mixed up a little bit. And this was something that we found when we were chatting with participants is that a lot of people would be like, oh, I'm not very tech savvy. I don't really know how to use the internet. But then they would tell us about how they had downloaded Facebook and they downloaded Zoom and they were like chatting with their family. And so it wasn't necessarily that they were not tech savvy, because obviously it takes a certain degree of tech savviness to do those things. It was that they didn't really have the confidence, or that they thought of themselves as not very tech savvy. I think that's a narrative that gets pushed a lot, especially with older adults, is that, oh, old people don't understand tech, which is really a shame because it's not necessarily true. Certainly there are folks who struggle with it, but I think that people tend to be a lot more tech savvy than they give themselves credit for. So that wasn't necessarily concrete advice, but it's not just about teaching people how to use the device, it's helping build confidence. That is something that I think Oats definitely focuses on in their trainings, in their sessions. One of the great things about them is that they do virtual trainings with folks. It's like a room of your peers. There's lots of people there who are asking questions. I think that can certainly help to build confidence when there are other people around you who have similar questions, who are learning at a similar pace. So those kinds of things are useful. Just really emphasizing that it's not about being or not being tech savvy, and that these things can be really simple and easy to use. And I think that one of the other things that we found in our user research, which we've done some other research with older adults this year actually, is folks are a lot more connected than they were at the beginning of the pandemic. So I think at the beginning of the pandemic, a lot of people were struggling a little bit. They were like, what is Zoom? How do I download it? At this point in time, it's a year into this, people have really adapted, and in a kind of unexpected way. Most of the older adults that we've talked to now have Zoom installed. They feel comfortable using it. They've really learned over the past year. People are absolutely capable of learning and adapting, and I think the pandemic has shown that. So one question here in the chat, which is, I really love the map that you used to identify your target participants incorporating COVID-19 data. Would you be able to give more details on how you use the 3 data sources to target participants? Like I said, some of that data came from open data. Some of it also came from our partners who we were working with. So some of the data came from NYCHA, and some of the data came from UHMH on COVID-19 rates. And so part of the reason we made that an interactive visualization is so that it could actually be used as a tool to zoom in on particular neighborhoods and to really see the areas. There was low internet access and lots of seniors living in developments. There were obviously other factors that went into the identification of participants, more information from NYCHA, things like that. But the map was really used as an initial way to say, okay, we are targeting neighborhoods we are targeting developments in this area versus this area. One of the other interesting considerations for that map is that the data came from lots of different sources, which means it didn't necessarily map one-to-one. So for example, some of the data was at the NTA level, which is neighborhood tabulation area. That's a specifically New York City geographic unit of measurement. And then some of it was at the zip code. NTA and zip code don't necessarily always perfectly overlap. We made the decision to not try to map those one-to-one, but just to do them as an overlay. It's really complicated to start trying to do that because of those different pieces of information. Yeah, I hope that answered that question. Let's see. How did you handle maintenance issues? Great question. I think this is probably specifically referring to maintenance of the tab. That was part of what the Oats hotline was there for, but there was also a T-Mobile call line. And so anyone who had any issues with their tablet could call the T-Mobile tech line. They That particular tagline is available in 100 languages, over 100 languages, I think, which is really fantastic. They use an interpretation service for a lot of those languages. And so that was the tech help line. And then the oats line was more of the like how to use the tablet and how to get comfortable with it. Our office in particular didn't necessarily work on that, although we are still pretty heavily involved in making sure that things are still working. So we still have an ongoing contract with Oats to do more longer term measurement and assessment and follow-up interviews and really make sure that things went smoothly. We have a question here, which is, do you know of any low income data plans for seniors? I do not know that information off the top of my head. I know I have a couple of colleagues in this call, so if they have answers to that question. I think it really depends on geographic area. And if you're talking about mobile data versus home broadband, I unfortunately don't have the answer to that question right off the top of my head. So I am sorry, I wish that I did. Unless there's any more questions, I think I'll go ahead and close it out. Thank you all so much for coming. You can connect with me on Twitter or LinkedIn. I'm always happy to chat more about this project or about any of the user experience research we do in general in our office. So thank you all so much for coming today.